Hi Calgary residents. Here's a quick clip I wanted to show you from a case we did last week on a patient presenting from urgent lab chole. This is an intraoperative parasternal scan, and the very first thing that we could notice here is this very thick septum and the anterior wall not being that thick. So this is very typical of hypertrophic cardiomyopathy, where you get this very asymmetrical hypertrophy. So on our next loop, we were looking to see if there was any outflow tract obstruction. We did put color on it, but the color loop didn't record very well. So what we want to be looking here is during systole, whether that mitral valve gets sucked into this outflow tract and whether this narrowing is significant. So we can look at color turbulent flow, we can put gradients through there, but even just looking at this 2D, it's pretty clear that this is not obstructing. So it is hypertrophied, but it's not obstructing. Now, the next loop is a short axis. And what I really want you to see is how small the cavity is on this short axis. So this patient has almost no cavity left in her ventricle. The ventricle is so thick that it's really struggling to relax and fill. And you can see why these patients would be incredibly preload, afterload, and rate sensitive. So just a quick little study to again show hypertrophied cardiomyopathy. And if you haven't looked at the February Dare to Diagnose clip, I do want you to go look at that, because I want you to really have a good concept of the difference between patients who get systolic anterior motion that is related to it and not related to hypertrophic cardiomyopathy. Because very often when I mention SAM, or systolic anterior motion, to you guys, immediately I get HOCM. Now HOCM can be overlapping with SAM, but it's not exactly the same thing. So please make sure that you separate it in your mind. And in this patient, clearly you can also have hypertrophied cardiomyopathy, but it's not always obstructive. So just really want you to get those concepts very clearly. Thank you for watching. Continue to focus on your POCUS and see you soon in the OR. Thank you.